Thank you for your interest in the Collective for Psychological Wellness's first webinar, Teen Depression and Anxiety in the Time of COVID-19. We did experience some technical difficulties with this first webinar, and the very end is cut off. However, the rest of the webinar is intact, and so please listen, enjoy, and share if you would like to. Thanks so much. We'll see you at the next one. All right, everyone, good morning and welcome to our very first live community meeting held by the Collective for Psychological Wellness. Today, members of our team are going to be discussing teen depression and anxiety in the time of COVID-19. Just a few logistical things. If you have questions, please either enter them in the chat, just enter the questions to everyone, or to me, Kelsey Raymond, if you feel more comfortable submitting them more anonymously. You can also add them to the Q&A section of the webinar, and we will get those answered either during the talk or towards the end. There will also be time for questions at the end. If you have any desire to learn more about our services, you can also private message me and I will be happy to set something up with you. And if you could just keep yourselves muted for the presentation, that would be amazing. And if you have any issues hearing people, seeing people as they're talking, please just enter a chat message and we can make sure to get that fixed. So without further ado, here is Dr. Elizabeth Olson.
Thank you all so much for coming to this live webinar today. I know that there is so much going on in the world right now that is raising people's anxieties, increasing our distress, and causing hopelessness for many people. And I think people are sometimes asking themselves, when will this ever end? What will give us and our families feelings of hope, reassurance, and security? So one of the things that I think about when I'm working with kids and families, and there's a lot going on in the external outside world that can cause us to feel out of control, is how can we come inside, how can we go inside ourselves, our families, and focus on what we can do and how we can cope more effectively, what we have control over, how we can improve our family relationships, how we can take care of ourselves and each other. And one of the things that I have seen that has come out of this very sudden and marked change in our lives with COVID is an opportunity actually for families to work through old difficulties, old wounds, dysfunctional dynamics, because many families are coming back together. And for many months, I know we've been really isolating together as families. And it's been, in a way, sort of an odd social experiment for all the difficulties to arise, but also an amazing opportunity for people to be able to work things through in the family. And part of why I'm speaking right now to the family is that one of the biggest indicators for kids' mental health, for kids doing well, is how cohesive a family is and how well a family gets along, and how close the parents and the kids feel with each other. So I'm going to talk a little bit about that towards the end of my portion of the talk today. So I'm going to discuss a little bit how I assess for anxiety and depression with teens. We are going to talk about some basic coping strategies, and I'm going to really emphasize the importance of the family relationships, because that really is a key factor in kids' mental health. While we're going to be offering suggestions and ideas in this webinar today, if you all have concerns, doubts, or questions about your kids and their mental health, I'm going to emphasize that it's really critical that you help them to meet with a professional to get a good assessment and a diagnosis to make sure what might be going on. Dr. Kaklauskis is joining us today, Melissa Horn and Rachel Fields. These are all staff members of the Collective for Psychological Wellness, and they will be talking today about coping and communicating effectively for teens and as a family. So if you all want to take a moment, and if you feel comfortable, You don't have to do this, but if you want to do it, you can private message or mention in the general chat box what some of your hopes are for the webinar, and also any specific challenges that you might be facing as parents, that your families might be experiencing, or that your kids might be experiencing. So I'm going to introduce myself. I'm a licensed clinical psychologist. I'm a licensed clinical social worker as well. I've been working with families, teens, and young adults since 1994 in outpatient, private practice, transitional living programs, residential and day treatment services, as well as university settings for a number of years. I started the Collective for Psychological Wellness probably about 4 or 5 years ago now. We're a team-based program, and we offer DBT groups, mentoring, family therapy, parent coaching, and individual psychotherapy. So I'm going to go ahead and let Francis introduce himself, Dr. Kuklauskis. And then Melissa and Rachel will also introduce themselves.
Hi, I'm Dr. Francis Kuklauskis. I love the topic of this talk. I think that there's times of great family moments and great family challenges at this time. I'm a licensed psychologist, have worked in Boulder for 30 years, and have held a variety of professorships at various universities.
I'm Melissa Horn. I'm a licensed professional counselor, registered psychotherapist, and I also do DBT both individually and group work for the Collective. I specialize in addiction issues of all kinds, trauma-informed care, and mindfulness awareness practices. I have years of experience working with tweens, adolescents, and young adults. And a little bit later on in the training, I'm going to talk about some DBT coping skills that we can start using with young people right now.
Hi, I'm Rachel Fields. I'm a licensed professional counselor located in Boulder. I work with individuals and groups in psychotherapy, and I also teach psychotherapy in a grad program locally. And my history is working with young adults who are experiencing acute and persistent mental health challenges. And since moving into private practice, I've continued working with young adults and teens. And I love working with teens who are experiencing anxiety and depression because I can relate. And I think that's a time of life where it can be scary, but also really exciting because it's a time of self-discovery, maybe awkwardness. And I really enjoy connecting with people at that stage of life and helping figure out how to relax into who they are and enjoy being themselves. A little bit later, I'm going to talk about communication strategies and what it is to validate your teen and to connect with them that way.
Thank you guys for introducing yourselves. So I'm going to go ahead and dive right into how I assess for depression and anxiety. One of the things that you want to look for when you're thinking about this with teenagers are external or environmental cues that could tip off a depression or an anxiety disorder. And COVID-19, unfortunately, has really created the kind of environment that makes it really possible for depression and anxiety to occur. So the kinds of things that we've experienced with COVID are very significant and very sudden disruption to routine. A decrease in activity. I can remember when in the second week of March this all occurred. It was really overnight that our family started quarantining. It was overnight that we stopped going to school or to work at the office. It was very disruptive, and it was just a huge change in, I think, everyone's life. The whole country just kind of shut down, and in fact, the whole world, I think. So some of the outcomes of that have been that there's been a big increase, I think, in screen use for adults and teens. And there's also been much more involvement on social media. We've had to physically distance from friends and family members, coworkers, and also I think our worries for family members and just our worries in general about the unknown. In the beginning, I remember there was just so much that we didn't know about this. And I think it really added to the feeling of it being such a crisis for us. And I know we're beginning to get more and more information, which I think information can be very soothing and calming for people. But in these last few months, really, we've had so much that we haven't known. So all of these things can really set the stage for depression and anxiety for teenagers. And I know that the hotlines, the mental health hotlines across the country have experienced like 1,000-fold increase in texts and calls over the last few months from the previous year. So this has really been a time where people are feeling quite distressed. One of the things that sometimes makes it hard to diagnose depression and anxiety in teenagers is that their brains are already really wired for moodiness, for anxiety, for emotional reactivity and emotional dysregulation. So the things that can be the kind of normal ups and downs or the normal tantrums or the normal anxieties that might come up for teens are sometimes difficult to differentiate. Is this really a diagnosis of depression? Is this really a diagnosis of anxiety? So some things about the teenage brain are that there is a real increase in hormone receptors in the limbic and the emotional brain, making the brain much more reactive to the emotions. There's also a real inability to control one's impulses because the limbic part of the brain, the more emotional part, hasn't really connected yet, isn't really talking yet with the prefrontal cortex, which is the home of executive functioning. Executive functioning basically puts the brakes on us, helps us to think through what are the long-term consequences here of what my actions are, helps us to have good judgment about things, helps us to recall from a more long-term memory, like how's this going to work out for me if I do this or react in this way. Excuse me. And unfortunately for teenagers, this part of the brain is not really online. So really parents, even in normal times, have to act like the cortex or the executive functioner for the teen because it's hard for them to do it for themselves. And then the other thing that I just will mention briefly, but that I think is fascinating, is that there's a hormone in the brain called THP. And in adults, it works as a tranquilizer and it calms the adult brain after the adult has been exposed to some kind of a stressful situation. I'm just going to take a drink. I seem to have a frog in my throat this morning. But in the teenage brain, it does the exact opposite. So when a stressful thing occurs for a teen and they have a stress reaction in the body, the teenager gets anxious, and when they get anxious, THP acts like a green light in the brain for more stress and for more anxiety. So given some of these factors, we can see how the teenage brain is already pretty fragile and pretty susceptible to depression and anxiety. And when you have these external situations compounding the problem, it can really increase the chances for depression and anxiety. So I'm going to talk a little bit about how to assess for depression, what to be on the lookout for. And I'm not going to go into as much depth as I would in an actual assessment, but I'm going to just go over some of the things that I think about so that you as parents can be aware about things to be looking for if you're wondering if your child has depression or anxiety. So two of the biggest things would be, has there been a sudden change in their mood or a sudden change in their functioning? Those are two indicators that you may be dealing with more of a diagnosis or a disorder versus the normal ups and downs that teenagers go through. The other things that I look for with depression are, the first two things are what you would call vegetative symptoms. This has to do with how are they sleeping and how is their appetite. what kinds of things are they eating? Are they eating enough? Are they not eating enough? Are they eating too much? Are they having trouble getting to sleep? Are they waking up early in the morning? Usually when I recommend a medication evaluation for a teen, it's because they are presenting with significant vegetative symptoms for depression. So those are kind of the two biggest things that I am looking for on a physical level. I'm also looking for how motivated are they? Are they able to get out of bed? Can they be motivated to get their schoolwork done? If they have jobs or internships, are they participating in those things? And I'm assessing for how well are they able to concentrate. I talk to them about how they would describe their mood. Are they able to take pleasure in things, to feel happy, to feel joyful at times? Are they agitated, hopeless, angry, sad? Sometimes with teenagers, depression can show up more as agitation and anger than it does necessarily in sadness. A huge indicator for depression and a significant risk factor actually is feeling worthless. So if your kids are talking with you and making comments that give you the impression that they aren't feeling worthy for themselves, or they're feeling ashamed or guilty, those can be big indicators to seek out a professional consultation. Low energy is something that I ask about, and also, of course, loneliness, which given COVID right now, I think we're seeing a really significant increase in that. And I know we're in the process of reopening right now, which brings a whole other host of, assessing how do you as a family want to be out in the world or not be out in the world? How much contact do you want to let your teens have with others? And in what ways do you want to do that? But I think it's important that they have some ways of being social with each other, because the loneliness is such a significant factor right now. I think another thing that's important to assess for is what kinds of things are they interested in? Do they have interests? Are they wanting to engage in learning or growing in various ways? And how much time are they on the screen? The screen is a really significant factor with depression and anxiety. When kids are doing interactive screen time, especially, it can really activate the sympathetic nervous system, which can make people feel much more anxious and then sometimes depressed. You can see kind of a spike sometimes in anxiety or irritation after a teen gets off of the screens, and then you can see the brain dipping back down into kind of just a more low level, flat, numb, or depressed kind of state. So screen time is something to consider for sure. And I think it's hard because in the beginning, there wasn't much else for kids to do. I mean, they could do things around the house, there's projects they could do, but I think for everybody, screen time went up. The other thing that I assess for is substance use, because it's not uncommon for kids to be self-medicating. And then sometimes if they are using substances, that can actually be causing a depression. So that's definitely something to assess for. I do also ask about self-harm. While self-harm is not necessarily an indicator of suicidal thinking, it can sometimes be a risk factor for suicide, because kids who self-harm have a higher tolerance for pain, which can make them more susceptible to suicide. So it is something that I do ask about. And then of course I ask kids if they're having any kinds of suicidal thoughts or homicidal, because this is, a thing that many teenagers do have thoughts about. Typically, a third of the teenagers who do have this kind of thinking sometimes take actions on that. And as we know, suicide is just a really high risk for teenagers. I think it's the second most common way that teenagers die right now. And then finally, what I'll say for depression is that I do recommend having parents get a general physical for their child. You want to rule out things like thyroid issues. Things like Hashimoto's disease can sometimes cause depression. It's a hypothyroid where the thyroid isn't active enough. And sometimes that can cause depression. And then there can be other health concerns. So it's just always good to get a physical when you're assessing for these things. And then in terms of anxiety, what I look for again is any kind of sudden changes. And I also look for levels of functioning because anxiety can be very impairing for kids. Again, I look for how are they sleeping, how are they eating. Sometimes with anxiety, kids have a harder time falling asleep. Sometimes you see that if people are really, really anxious, the sympathetic system can cause people's appetites to decrease, but it can also cause the appetites to increase. So again, you're looking for, are there any differences in how kids are eating? And then another question that I ask is about panic attacks, because for a portion of kids who have anxiety, they do experience panic attacks. And there are some pretty quick and easy things that you can do to help reverse a panic attack once it starts. So I like to know, is this something that they're experiencing? Because it can be quite terrifying when panic takes over the body. Another way that teenagers sometimes express anxiety and also depression, so I do assess for this, are somatic symptoms. So are they experiencing stomach aches, headaches frequently? Are they tired a lot of the time? Do they experience trembling and sweating? So what's going on physically in their bodies for them? Anxiety can be a very physical disorder. It can come out in lots of physical expressions. Substance abuse is another thing that I really consider for anxiety, especially with things like alcohol, benzodiazepines, and pain medication, because kids will use those three things as a way to calm their anxiety down and to relieve them of their inhibitions. So it can be something that helps them sometimes feel better in social situations. So I'll also ask about concentration, because anxiety can really interfere with concentration. I had a client this week who I've been working with for many years, and she's now in nursing school, but she was talking about what a terrible time she's having concentrating. And when she gets anxious, she sometimes gets really hard on herself about the anxiety. And then when she's being hard on herself, it makes her even more anxious, and it makes it even harder for her to concentrate. So concentration can be a big indicator for anxiety and can really interfere with how kids are functioning at school or at work. I also ask about social situations and how stressful those kinds of things are for kids, because over the last 10 years, I think in part due to how much digital access kids have, there's been a huge increase in social anxiety. And so that's one that I really look to try to assess for and understand what kinds of things might be going on that keep kids from feeling comfortable in social situations. And then a big thing that I look at is avoidance, because avoidance is really the #1 defense mechanism. It's the #1 coping mechanism that kids will use when they're anxious. What avoidance does is it gives kids immediate relief from the anxiety, but the problem with it is that it perpetuates the behavior, because when you avoid, you get that immediate reinforcement of feeling relief and feeling better. And so it can decrease anxiety right away. The problem then is that it's very self-reinforcing, and it teaches kids that they can just keep avoiding to reduce their anxiety. But then it really can get in the way of them going to school or getting their work done or engaging in social situations with other people. So avoidance is a significant factor. I ask kids about their worries, what kinds of things are on their mind that are worrying them. And then I also assess for suicidal ideation, because there have been times over the years that kids who are anxious are actually more suicidal than kids, who are depressed. It's a way to get relief from the situation when the anxiety is really high. So suicide is something that's really important to assess for. I also ask about questions like, are they experiencing any obsessive or repetitive or ruminative thoughts? Are they feeling out of control in any ways? And do they have any compulsions? So those are kind of the general things that I look for in kids who are dealing with anxiety. And you guys are welcome to chat any questions that you have as I go, and we will come back to them during the portion at the end when we leave it open for responding to questions. So some basic things I'm going to just mention briefly. Many of you guys, I'm sure, already know about some of these things, but I tend to kind of have three main things that I recommend for both depression and anxiety, because they all have really beneficial effects for the brain, and they all balance the brain in various ways that can be helpful. So especially for parents who have concerns about their kids taking medication, which I completely understand, and I tend to be someone myself who uses medications as a last resort, given that they have black box warnings for teenagers regarding suicide and the possibility of increasing suicidal behavior in teens. So it's a balance, and you have to kind of monitor that very closely if you're going to go with the approach of using medication. But I always like to try behavioral strategies first, because I think they can be very effective. So the number one thing that I think really helps is exercise. So getting aerobic exercise, I would say 4 to 5 times a week for 20 to 30 minutes. And things that we can do right now that it's summertime and we can be outside, not cooped up inside, or biking, running with friends. We have one kid that we know in the neighborhood who's been doing a running group with his friends this whole time outside. You can go on a hike as a family, of course, any kind of exercise. And I do think it's helpful if you can to be outside, because then you get the bonus of the vitamin D, which can also be helpful for depression. And in Colorado, for some reason, I think we have a harder time absorbing the vitamin D from the sun. So that can be an important piece to get checked out and assessed for in a physical as well, because that can make a difference with depression. The other thing that I recommend is meditation, and I recommend this for parents as well as teens. John Kabat-Zinn has a great program called Mindfulness-Based Stress Reduction, which parents can do online. There's also local groups. One of my favorites is the Center for Courageous Living with Janet Salinches, and she is currently doing her courses virtually. This can be fun to take the course together as a family, and to do the meditation together if you want to. But there's also an MBSR course, I believe, online for teens, which could be helpful too. There's Headspace, which is a great app that the family can do together. And then there's Calm, which is another app that some of my families have enjoyed working with. And then the third thing that I recommend is progressive relaxation. And Carolyn McManus has a website with free downloads. And basically what progressive relaxation does is it helps to balance the sympathetic and the parasympathetic system, so the autonomic nervous system. So with each of these things, exercise, meditation, progressive relaxation, you get a little bit of a different piece that helps the brain. With exercise, one of the things that you get is just an overall balance in the neurotransmitters. When you take something like a selective serotonin reuptake inhibitor, an antidepressant, what happens is that it's acting on one neurotransmitter, and that may be helpful for depression, that may be helpful for anxiety, but the problem is that it can also throw the brain a little bit out of whack because it's emphasizing that one neurotransmitter. The benefit of exercise is that all the neurotransmitters come into balance. So that's one of the reasons why I like it so much. And I have to tell you that over the years when I've been working with kids who are athletes, one of the things that I've noticed is that if they get an injury, if for some reason they have to be pulled out of their sports team, what happens for these kids is that they often experience a depression because their baseline is different than kids who aren't athletes. Their brain has basically gotten used to exercising at such a high level that when that drops out, they, I think, are much more at risk for depression. And so that's another factor here in COVID. When everything just suddenly stopped, all the exercising, all the team sports, all the physical activities. My son was going to CrossFit 3 times a week. Everything just had to stop. And so we had to reevaluate, and we do have to reevaluate how can we keep getting kids that brain balance that they need, especially if they've been athletic, previous to COVID. Meditation works on many parts of the brain as well and can be really helpful for increasing the size of the prefrontal cortex, so helping people to be able to manage their impulses better and their reactivity. And it can also decrease some of the more emotionally reactive parts of the brain as well. Especially, there was a study that was done where if you do 20 minutes a day for 8 weeks, you can literally rewire your brain, and it does sometimes even have semi-permanent effects. So those are my top 3 things that I recommend behaviorally. I mentioned earlier that with panic attacks, something that you can do that's helpful if a panic attack is coming on for your teen or for anyone in your family, you can pretty much immediately stop the panic by having a person lie down and put their feet above their head, so they can rest their feet on a chair, on a couch, on a bed. In yoga, people will do this where they have their legs on the wall. The main thing is just getting your feet up and your legs above your head. Doing that activates the parasympathetic system right away. And I've had clients call me in the middle of a panic attack, and I've said, okay, just lay down, get your feet up. And within about 2 minutes, they're feeling much better. And then if you want to compound the benefits, you help your teen to exhale twice as long as they're inhaling. So we have some DBT exercises that we use that help to do this, but you can breathe in for the count of 4 and then exhale up to the count of 8. And that is also activating of the parasympathetic system. And I do recommend doing this on a daily basis if you have a teen who tends to be more sensitive to anxiety, just because it helps to reset the baseline and helps them to just be generally less anxious, so that they have more reserves to draw on when they get really stressed. And then the final thing that I recommend from a behavioral standpoint is just having like a stress basket in the family somewhere in the house, where as a family you come up with things that you can use. So in our family, we have this thing that you can put on your head that kind of causes relaxation when you do that, and we kind of surprise each other sometimes by coming up and doing that if we think somebody's stressed, to help them, get relaxed and remember to breathe and just take a moment. We have these different, I purchased this ball that one of my clients recommended that I guess is for physical therapy, but you can stick it in the freezer and it gets really cold. And when you take it out, you can rub it on the body, and changing the temperature can be really helpful to reduce stress. So something really cold. You can also get those squishy balls that are good for stress. The other things to think about are things like having things that smell nice, that are comforting. What kinds of things are comforting that you could have in the basket? Cups of tea that people could pick from, things like that. So those are my behavioral strategies, and we have many, many more, but I'm not going to spend as much time on that. I will also say that I think it's important right now to be limiting screen time if you aren't already. As a working parent, this is hard for me because I'm typically meeting with clients in another part of the house. My husband's a professor, so he's often teaching or doing things at another part of the house. And so it's hard for us sometimes to manage that. So we've been looking into different web services. I found one that's called Net Nanny that allows you as a parent to decide how much screen time you want them to do and what sites you feel comfortable with them going to. So I do recommend, if you can't be with them more of the time, to help them manage that, to consider maybe even removing yourself from the power struggle if there is one, and having some limits on the screens themselves, that the devices that they're using. And then other things that you can think about are activities and outlets. Feelings get generated and they don't just go away. So we have to have ways to discharge them and get them out. And I recommend coming up with whatever creative things you can. I know many of you are already doing that. Things that we've been doing in our family are games of all different kinds. We've been getting really into chess lately. I had my son sign up for a virtual cooking class through the food lab in Boulder, and it was kind of amazing because you go, you pick up the groceries at the beginning of the week, and then they get online and you can be working and they cook, a fabulous lunch, and then, everybody gets a good healthy lunch that day. And the food was really pretty amazing. But just coming up with things that you think that they could do that they enjoy, that they're interested in. Another great resource is outschool.com. They have a ton of different types of classes that kids might be interested in, from the arts to the histories to political science to all kinds of different things. And then, one of the other things that I think is really valuable is music right now, because it really gets us into our heart and into our emotions, hopefully in a good way, and can help us feel connected. So if you are doing dinners together, which I also recommend, it can be nice to put music on at that time. Music is a great mood lifter a lot of the time as well, and can be a good coping mechanism. So I'm going to talk now briefly, and then I'm going to pass it over to Melissa, Rachel, and Dr. Kaklauskis. But I wanted to just speak very briefly to this piece that I think is so important, which is getting together and getting along as a family. I think it's really a key protective factor for teens with mental health. I'm going to be giving another webinar in a month on suicide prevention. And one of the biggest risk factors for teens with depression, with mental health issues, and with suicide is high conflict in the family. So either between the parents or between the kid and the parents. And just because they're teenagers does not necessarily mean that you have to have a fighting relationship or that you can't have a close relationship. It is possible to do it. It is sometimes hard to do because as the parent, you end up tolerating a lot of difficult feelings. And yet I think it's really important. And in this book that I'm reading about empirical evidence for protecting and preventing suicide in teens, they talk about attachment family therapy as one of the more important approaches to helping parents repair their relationship with the child, and how important that is to reduce the factors of depression, anxiety, and suicide. So I'm going to talk a little bit about some tips and some ways that I think that can be helpful for parents. So I've been really enjoying and reading a book called Hold On to Your Kids. It's by Gordon Neufeld. And he has some wonderful recommendations and some wonderful ideas about how to repair your relationship and how to kind of build that back up again if it's been damaged. And so some of the thoughts and ideas I've kind of taken from his work, but I'm also bringing in some things that I think about as well. So simple things that you can do in the morning when you see your child, to connect with them, to greet them first thing in the morning, to ask them how they slept, how they're doing. He talks about the importance of greeting them after a separation. So there's times where I'll be upstairs and I'll be thinking, well, did he brush his teeth? Did he take a shower? Did he do this? Did he do that? Did he eat? Did he get his Khan Academy done? These kinds of things. And if I come down and I start that way with my son, it immediately puts us at odds with each other. But if I can go down and say, hey, how's your day been? What have you been doing today? What's it been like? What are you working on? What are you interested in? Did you, get a chance to eat? If I can do it in a way that's more connecting and more kind and loving, then he's much more receptive actually to me giving him a direction or a request to get something done. So Gordon Neufeld talks about the importance of putting the relationship first above the behavior, and really trying to understand that when you are disciplining your child, if you are trying to do it in a pretty authoritative kind of way where you're telling them what to do, it's mostly futile and ineffective, and it actually pushes them away and can cause more damage in the relationship, which can lead to more depression and anxiety. So sometimes this is really hard to do, but it's very important as much as possible to really provide an environment at home where they feel safe and where they feel like they can just rest and be, and have that unconditional sense of acceptance. And one of the things that Gordon Neufeld talks about also is even when you're homeschooling or school is going on at home, making sure that home is first above everything else, that the relationships in the family come first before just addressing any of the behavioral or school issues, which I know as a parent, you know, that it is difficult to do that sometimes, but as much as you can, it's beneficial for them and for helping them be protected from depression and anxiety. Some of the things that he mentions also is just to really enjoy your kids. So it's important to be the parent who initiates the activities so that it feels for the kid like you're almost surprising them with your interest in wanting to be with them. So how do you engage them and say, you know, oh, would you like to play this game tonight? Or I'm looking forward to when we can get together and go for that walk. Or I'm looking forward to going to the bike park with you, where you are the one who really lets them know that you're interested in them, that you initiate the activities that you can do that's enjoyable together. And when you do that, and you give them the feeling that this is truly and genuinely and authentically coming from you, that you want this with them, you are giving them more of a feeling of worth, that they matter. We're also, I recommend the importance of thinking about repairing if there has been a fight or a rupture. So not that you have to be the perfect, all-loving parent at all times. I think that's really hard to do. But when you do get blamey, when you do get dysregulated, when you do get impatient, tired, or annoyed, really be the one to try to make an effort to repair. And I have so many kids that I've worked with over the years and adults who have said, yeah, my parents never apologized to me. They just refused to ever apologize. And apologizing and really hearing what your kids have to say, so letting them speak truthfully to you about how they were affected or hurt or angry with you, I think is really important. And apologizing to them and working together to find a different way for you to work on how you could do better, I think is really important. And I do think it's up to the parent to be the one to do better, actually, because when I'm doing better as a parent, things go better with my son and he feels better. And so it's the same, I think, for all of us as parents. It's on us, I think, to really create the environment that helps them to feel good. So let's see here.
Elizabeth, before you continue, will you please repeat the name of the book and the author?
Yeah, his name is Gordon Neufeld. I think it's Nuefeld, and it's called Holding On to Your Kids, or Hold On to Your Kids. He wrote it in conjunction with Gabor Mate. And, you know, I don't necessarily agree with everything in it, but I think there's so much in it that's really valuable and important for us. So I'll just end this portion of it by saying some tips that I think you can be thoughtful about. Being aware of your voice tone, the way that you're speaking and the way that you sound goes deeper than what you actually say. That's a direct communication to the more procedural emotional parts of the brain. So having a loving tone, a kind tone, rather than a cold, harsh, punitive, or demanding tone is going to be much more effective. If you are cold, harsh, punitive, or demanding, being able to notice that you're doing that in your tone and trying to change how you're talking is really important. Making eye contact, smiling, emphasizing to your kids that you're with them, that you want to be with them, and that you're going to stay connected with them no matter what. Being affectionate, I think, is really important. Giving hugs, back rubs, any kind of kind gesture that your kid would enjoy. Affection, I think, is just really meaningful to them, and especially right now with everything that we're going through. So basically, my point is I just want to emphasize that this is a time of opportunity. It's a time that you can come together as a family and make some changes with how you're interacting, and it can be protective for them, for the kids with their mental health issues. So I think Francis is going to speak a little bit next, and then we'll hear from Melissa and Rachel.
Hi, I'm enjoying looking at the chat, and if there's more questions or things people would like us to comment on, please put those in the chat. I like the first message, which was even therapy is screen time. And it made me think of what's worthwhile screen time and what's not worthwhile screen time. But working as a therapist now, we often make an agreement with the people I talk with, is that we don't have to stare at each other on the screen. We can look out the window, we can listen to each other, we can check in from time to time. But if I think I wanted to make one point, is that if families are having a hard time, it doesn't mean you're doing anything wrong. That life and raising a teenager in general can be very challenging with ups and downs, and because the family or teen is having a hard time doesn't mean that you're bad or they're bad. I think in my experience of working with families, the desire is often to find the single cause and to attribute blame. So sometimes people will blame the child. You snuck in and ate all this chocolate and now you're really moody, or you haven't been exercising, or you've been on too much screen time. And what I often see quite a bit is parents blaming each other. You're not holding the boundaries. You're forcing me to be the bad person here. I have to be the police officer. You get to be the Disneyland dad, as they say. And I think that within families, it's best to think about the challenges not as residing in any one person particularly, but what's going on in that larger system. Like as the old model that was popular in early family therapy videos about a mobile. And if you move one piece of the mobile, if dad is stressed hypothetically because he has 20 papers to grade and he's acting more moody, that will shake everyone in the family in some way. So I like this idea of with families and even in family conversations to put the problem not inside people but out there somewhere. The classic technique would be you would put a pillow on the floor and say, here's our problems. We scream and yell at dinner. Bedtime's always a fight. You're not brushing your teeth. And most teenagers have a series of complaints about their parents also. And you can kind of look at it and say, okay, well, here's our issues out here. What might we do to kind of adjust and fix the challenges that we're facing? So I think those are my two major points. One is that if you're having a hard time, it doesn't mean someone's doing something wrong. And then I think the second one is be careful attributing blame, which can lead to low self-esteem, and no one functions best with low self-esteem. It's a time of creativity. How can we address this challenge in a way that's interesting? Could we even do a science experiment? Let's all try going to bed at 10, or let's try turning off the screen at 8 and see what happens. Let's walk the dogs before going to bed and see what is effective. There's a famous saying that blame doesn't lead to understanding. Generally, people just fight against feeling blamed, and it kind of shuts down their ability to think critically and be creative. So I think that's my thoughts and advice, and I am wishing everyone well. And we are continuing to struggle, and I continue to fluctuate between great hopefulness for my family and other families, and trying not to dwell in despair too much. If I had one last final piece of advice, is I think parent timeouts are good at these times. If I've had a long day and I know I'm edgy, I might put myself in timeout in some way so I can function with the people who I love most better.
Thank you, Francis. I appreciate it. Full disclosure, Francis is my husband, so we're both psychologists, and we also are raising our son together. So I appreciate it.
Something we do that's very important is that we don't play psychoanalysts to one another. We try to be partners and supportive to one another. And in my experience, working with families and couples, the desire to be each other's therapist or to point out what's wrong with one another is often overwhelming in families and couples. And I think even if you have a hint about what the challenge is, the challenge for you is to figure out, how can I help this go better? And usually pointing it out and making some grand interpretation about their parents and their childhood just digs a deeper hole for family unity and progress.
Yeah, thank you. All right, Melissa, take it away with DBT.
Sure. So I think it's important to maybe just talk about what DBT is a little bit before we get started. So it's black and white thinking. Dialectics are opposites. So just as Francis mentioned, feeling pulled in two different directions at the same time. And so a lot about DBT is finding middle path. Right now we're living in a very polarized society. You might be experiencing polarization around a lot of different topics within your own family system. And so finding a way to live together, be a family, finding a way to take all of this information we're receiving and synthesize it and act in a safe way and keep everybody in our system safe. We're also looking, when we talk about dialectical behavior therapy, we're trying to find a willingness to change the behavior. So any young person that I work with, that's one of the first questions I ask them, like, are you ready to work on this and to be more healthy, and finding that willingness versus willfulness in them so I can talk about it when resistance comes up, but I have a better language with it and I'm not pointing my finger saying you're resisting treatment. It's more like, where's that willingness we talked about at the beginning, and trying to find it. It's missing. So depression and anxiety in teens can make them feel completely incapable. It might make parents feel like their teens or young adults are completely incapable of taking care of themselves. You might worry about what it will look like when they leave the house, or if they're already out, and their functionality over time. So with DBT, we give young people a step-by-step way to do all of the different coping skills that Elizabeth was talking about earlier. DBT has a lot of, they just break it down, different letters like TIP, TIPP, is tip the temperature, intense exercise, paced breathing, and progressive relaxation. And so when we teach skills like TIP, we are really just breaking it down and talking about each little piece. And as a DBT instructor, I would help them understand tip the temperature, like cooling their autonomic nervous systems, slowing their heart rate down. And I would give instructions on how to do things like paced breathing and progressive relaxation. We want to do risk assessment. We want them to understand how they assess risk, like continuously when they're out with their friends, now when they're out just, trying to go to the grocery store with a mask and hand sanitizer and hand washing. We have this new level of risk assessment that we're constantly doing. We want to think critically about how symptoms and behaviors are harmful and talk about them. And if really harmful behaviors and symptoms are coming up, we talk about it more. We try not to shy away from bad things that are happening. We may feel induced to do that because it's impolite to talk about things like self-harm or addiction. But in some ways, I think it's important for them to have a space where they feel comfortable talking about it. And maybe that's not with their parents at all times. We want to work towards the delay of gratification. Some things take time. Incremental, small shifts make giant changes in time. And so working really hard towards delaying some of that gratification, the feeling that it needs to happen right away, or they're gonna give up. Part of that is self-soothing and crisis intervention, like dealing with different uh, problems as they arise. Big problems will eventually arise if they're not happening right now. And so having some skills to deal, like identifying crisis, knowing when you're in it. Francis kind of was talking about the stop, like putting himself in adult timeout. That's stop, observe, try to decide whether or not it's a good time for you to jump in. And when you're ready, you can participate mindfully, but giving your nervous system and your brain a break in between one thing and the next. Maybe it's a break in between something occurring and reactivity. You need to take a little space right there and find the gap. And that takes time. You'll watch yourself make mistakes, then you'll catch yourself doing it, and then hopefully you can get in front of it a little bit. Um, we want to problem solve skills, including interpersonal conflict. We want also teens, though, to take risks and engage safely. It's part of getting out and doing things. How do we do that now in the age of COVID? We want to confront fears and overcome avoidance that keeps them from experiencing life, and find a middle path there. And then one of the last goals is self-care. Including things like setting appointments that require forward thinking. I work with a lot of young adults who can't really set doctor's appointments without some help, and so giving them agency, like saying, all right, this is where you go, this is how you do it. And so those are the types of care that might be needed later if they don't happen kind of earlier. So we're talking about psychoeducation in these types of groups. Um, it's important to understand what's going on in the autonomic nervous system, to understand biosocial theory. Like, you might be more prone to these things genetically. You might be able to look at your family line and see a pattern. It also might be that you're in an invalidating social environment. And so that has changed recently. Everything has changed, and so the social environment is something we need to be looking closely at now that we may not be having the same problems we had in school, but we have different issues that we're working with now, especially moving into summer where there's just not a whole lot going on and no camps. It's hard to get a job. So there are 4 modules in DBT. They include distress tolerance, which is usually where I start with new people to give them coping skills immediately. There's also mindfulness, which is an area of my expertise. Interpersonal effectiveness. So it's really good to understand how you're affecting other people and yourself. And then emotional regulation. Distress tolerance, we develop a crisis and a safety plan, and we make an individualized de-stress kit with little anxiety toys, whatever works well for the individual at hand. Distract is one of the first skills that's usually taught, and knowing how to distract mindfully instead of mindlessly. So again, some screen time is going to be mindful and some of it is going to be mindless. Things like video games are actually more engaging than watching something like Netflix, and it's all on a spectrum. So being aware of what activities and what types of screen time are mindful versus mindless. We want to do activities, we want to be contributing to our society, reducing the amount of comparisons we make to ourselves and others, and really working on how to regulate ourselves in difficult moments. This is what distress tolerance is all about. It's about being in distress. Mindfulness, meditation practices, using logic and emotion together is what creates wisdom. If you're acting all in logic, you might be discounting people's feelings. You might be discounting important humanitarian issues. If you're operating all in emotion, you might not be able to get anything done. And so you can cultivate wisdom at any time by being able to combine logic and emotion together, which is wise mind, one of the basic DBT skills. Finally, we have interpersonal effectiveness, how to be assertive effectively. It's one thing to speak your mind, and it's another thing to speak your mind in a way where people actually can hear you. We're always seeking middle path when it comes to that, and we're learning how to validate others, which is what Rachel is going to talk about. And then with emotional regulation, we want to make sure we're addressing the body and the mind. Both. They play off each other. They're very important. We're talking a lot about what Elizabeth was addressing around physical health, and understanding your emotions, being able to label them and just saying, I'm sad, or having complex emotions that are maybe paradoxical, like when you're fighting with your family and you love them, but right now you hate them. So that's back to black and white thinking and trying to find middle path and realize that you can hold both. You don't have to vacillate between love and hate. You both love and hate at the same time, and that's okay. So that's my speech about DBT and how I feel like it can be effective. As we move forward with these meetings, I plan to go a little bit deeper into individual skills that feel applicable to the topic at hand. So thank you.
Thank you, Melissa. And now Rachel is going to speak about validation.
Yeah, so I'm going to talk about this communication strategy called validation. It's a very helpful strategy or skill to have in relating really with anyone. So using it with your partner, friends, coworkers, and it can be particularly helpful in relating to teens. One of the primary things that's communicated when you validate another person is the subtext of it is, I understand you. Working one-on-one with teens, something that I experience a lot is teens saying they don't feel understood by their parents. And so I do a lot of validating. And so what validating looks like is noticing the thoughts and feelings a person is having and acknowledging them, and then communicating that their thoughts and feelings make sense given the situation at hand. So it doesn't mean that you're agreeing maybe with some behavior that's being exhibited. So that's an important point. You're just acknowledging that you understand how they're thinking and feeling. You can also still hold a boundary of, and the behavior that resulted from thinking and feeling that way, that's not acceptable. So a brief example, maybe you have a teen who her friends are getting together and she wants to use the car to go over and hang out at their house. And for whatever reason, tonight is not a night you're going to let her use the car. So often how that conversation can go is, as the parent, we will make our case about why the teen isn't going to use the car. And then the teen responds with their case about why they should be able to use the car. And often what can happen there is this dynamic can escalate into an argument. So a way to use validation there would be, what you want to do is you note their thoughts and feelings, and then you reflect it back to them. So in this situation, it might look something like, you're really pissed. You want to use the car and I'm not letting you. And your friends are all getting together and you're going to miss out on it, and you feel really disappointed. Letting them know, I see you. So what you're communicating there is, I see you, I understand you, your thoughts and feelings make sense, and you have permission to have all those feelings. Now, it doesn't mean I'm going to let you take the car, but I'm connected with you here, building our relationship, showing you I value you, and we can still have different opinions. So let's see. Oh, yes. Another benefit of validating is that when you're showing a teen that you understand their thinking and how they're feeling about something, and that you're giving them permission, that you're accepting it. You're not telling them, I need you to think and feel differently. You're modeling for them that they can do that for themselves, that they can accept their own thoughts and feelings, even when they're hard. And research has indicated that parental validation is associated with increased regulation in teens, emotional regulation, and also greater satisfaction in the parent-child relationship. So what we have now is a video that we'll watch that shows two examples of an interaction. So a parent wanting a child to do something or a teen. The first example is what not to do. It's getting stuck in the details of, I want this, you want that. And the second example is an example of validation where you'll see it's Elizabeth. She recognizes her son's thoughts and feelings and lets him know that she understands where he is. So now we'll go ahead and watch that.
Sorry, you guys, 1 second. We're just having a technical difficulty. Just 1 moment, please.
There was a question in the chat about indoor activities. And while Kelsey's working on the